Welcome to this very special episode of By the Way. I'm Shipra Narayan. And today, as we see, as the whole country is fighting the pandemic, the COVID-19 onslaught that has come on us, our latest figures that have come in the past 24 hours show 392,000 people who have got positive because of COVID-19. There have been 3,600 plus deaths that have happened because of this. Now, these are alarming figures. Day before yesterday, we had an all-time high where our numbers exceeded beyond the 4 lakh mark. Where are we headed? There are reports coming in from most states about vaccine shortage, about registration being done, but vaccines not being available, oxygen cylinders not being available, beds not being available. We've been hearing stories that have literally shaken our conscience every single moment. But at the same time, when all of this is happening, it is very crucial to get the right answers, to get the right solutions. And that is the reason why at News Mobile, we are constantly in discussions with senior doctors across the country to try and get to you answers to most of the issues, to problems that each one of us, the laymen, are asking, but are not very sure of. Thank you so much. Today, I have Dr. Viveka Kumar with me. He's the Principal Director and Chief of Cath Lab Span Max Cardiac Sciences Cardiology at Max Healthcare. Dr. Viveka, thank you so much for being with us. I'm going to ask you a few questions, Dr. Kumar, and these are questions that have come to us from our readers and viewers of News Mobile. My first question is, a lot of people nowadays, the cases that are coming in are getting heart attacks during COVID. How do we relate this, if at all?
Yeah, that's a very good question, Shipra. If I may say that one of the problems with COVID is that, not only it is dangerous in people who have got a pre-existing heart disease, but also those who did not ever had any heart disease, including the young or the old, male or the female, the cardiovascular involvement is very high. The involvement would be anything from 7 to 17% of the people who get infected with COVID. So this is the data from people who get hospitalized. Out of all those hospitalized, so this is data from capacity COVID data where 4,000 patients were included across the globe. And this is really, really alarming because with the cardiac involvement, the mortality goes up very high. If you know the normal mortality 2 to maximum 1.5 to 3%. But with cardiac involvement, it can go up to 18 to 24%.
Okay. Dr. Kumar, you said one thing, that there are two things. One is people who could have had an underlying condition, but also for people who do not have any such condition, any past history of having any heart-related problems. Now, when people are at home, when they're under self-isolation, they have tested positive, they have some symptoms. How do they realize that they have actually crossed the line? Because they could be having fever, which is under normal conditions. Everything otherwise is in, within the parameters. But yet we've seen cases where that sudden cross of line has happened, and then it's been a very, very sudden deterioration. How do people, a layman, a person like me, how do we realize that now's the time when we need to go beyond what we're doing at home?
Yeah, that's a very brilliant question. I tell you that the symptoms of cardiac involvement would be same as in a person who did not have COVID at all. So it would be like significant chest pain associated with sweating, and it is like constant pain lasting for more than 15 to 20 minutes, associated with sweating, feeling of impending doom. So this is called COVID-induced heart attack. It could be there, and we should not waste time, immediately get the ECG done, and then appropriate treatment should be done. The second type of problems are what we call cardiac arrhythmias, where the heart beating will be fast or even slow. So the patient may have racing of heartbeat or very slow heartbeat, which we call bradyarrhythmias. And if it is causing dizziness symptoms, the patient is not settling down within a minute or two, then I think the patient should rush in for specialist care. At least an ECG should be done to diagnose. Other thing which is very alarming, where just the awareness can save the patient, is called sudden cardiac arrest, where the chances of survival is less than 3 to 10%. Sudden cardiac arrest is again a very fast heartbeat, which is more common in people who are having pre-existing heart diseases. Those hearts are weaker. The sudden cardiac arrest is also a common presentation of patients with COVID, those who have got pre-existing heart disease. Nonetheless, it can happen even in a normal person. So fast heartbeat, chest pain, sweating, and feeling of impending doom. Meaning, even if the ECG is normal, if the patient is feeling that something is terribly wrong with me, I think he should be further evaluated.
Right. And Dr. Kumar, is also the oximeter, because that's something that has now become a household thing. Everybody is there, whether they are COVID positive or not. People are now keeping oximeters at home. They are using it, especially when they have tested positive. Is that also an indicator that something could be going wrong if their oximeter readings are, less than, say, 95, 94, or 92?
Absolutely right. So I think the saturation also can precipitate. If somebody is saturating less than 90, then it can put stress on heart and the patient can have cardiac arrest or heart attack also. So one should look for the danger zone is that the moment saturation starts going below 92% and more specifically below 90, then one should look at that we need to get oxygen. And treatment is simple. Just give few liters of oxygen flow and the saturation normalizes and the stress on the heart decreases. At the same time, with the same oximetry, one can look at the pulse rate also. So if the heart beating is going higher than 120, then one has to look at the remedial actions. Because of the anxiety, it can go up to 100, but if it is going beyond 120, 130, then one should be careful. At the same time, on the other side of the spectrum, if it is going slow, lower than 50, then one should also watch for that and then get a specialist consultation.
Okay. Now assume there is a person who is going through all of this. Now, from the time they start realizing that they could be having some heart-related issues and they are COVID positive, till the point of time they actually get to the hospital or get some medical attention, are there any home remedies or any quick techniques that they can themselves do to ensure the longevity of that time till the time they actually get the medical attention?
Yes, so I think till the medical attention is available, one can take deep breath, lie in prone position so that the oxygen saturation improves, because one can recruit more and more lung tissues by lying in prone position. Take deep breathing. And if those people who have got access to what we call steroid inhaler, so one can have nebulization of that or inhalation of that. If the chest pain is happening, one can take the blood thinner and the nitrate tablet under the tongue, which is commonly available. One can take that if access to that is there. So common sense has to be, preserved. And we have seen that many times by not utilizing the common sense and getting panic mode can precipitate the cardiac event further, because the more you're stressed out, the heartbeat goes faster and it can further precipitate the adverse event. So keep yourself cool and calm. Be in touch with your doctor, and then these remedial actions at home can help a lot.
Absolutely. I think that was just so concise and very, very clear, Dr. Kumar. I also have a few myths. As I said, News Mobile is a fact-checking organization. We have been more, from the time the pandemic started in the country, have been trying to bust myths and fake news, which is traversing across, all mediums, whether it is about COVID itself or vaccinations or anything else. Now, there are a lot of questions again around this that are coming in, and I want to ask you a few questions around it in terms of the myths versus what the reality is. Now, we are hearing from a lot of people that, and again, this is a myth and coming across vaccine hesitancy, that taking the vaccine actually could lead to long-term complications and problems. Hence, may not be a great idea to actually take vaccines. How would you address this kind of vaccine hesitancy that is happening at the moment?
So I'm glad, Shipra, that you brought this point. This is very, very important. It's not only in general population, but we had seen a lot of doctor community also were feeling the same way. But I tell you that the data of the second wave has shown that the people who survived this onslaught of this pandemic where those who were vaccinated, even one dose of vaccine prevented from, the protection rate was almost 45 to 50%, and two doses, the protection rates were almost 95%. So you can imagine how protective it was. And even if the people got the infection, they did not go on to ventilator or, serious hospitalization or the complications. So meaning thereby that the vaccine does protect, and those people who have got pre-existing high risk factors like heart disease, heart failure, kidney disease, diabetes, and high blood pressure, these are the people, they must get it. And government has also rightly prioritized that they should have got. So most of the people have got in the first lot. And coming to the hesitancy, it is totally unfounded. And if you look at the global data, whichever vaccine has been given, they have protected the population. So I must say, and loud and clear, the message should be that the vaccine is here to protect the humanity and prevent the pandemic from persisting for a long time.
Right, thank you. And I think a very, very clear message from you, Dr. Kumar. Another myth that is coming to us is the fact that there are herbal, medication that can also cure COVID rather than getting into the allopathic part of it, which is medication, vaccination. So if you do your home remedial treatments, and we've seen a onslaught of all of these kind of treatments that have come in, it would have the same effect. What would you like to say to that, Dr. Kumar?
Yeah, so basically, I would say that it's not only COVID, but many other diseases. There has been myth that, the what we call non-allopathic or non-modern medicines can work out. So let me tell that, anything which involves good lifestyle would work, whether you take modern medicine or you take any medicine. So they are correct up to the stage where the lifestyle modification, meaning by eating healthy, doing regular exercise, breathing fresh air, these things are perfectly okay. There is no medicine which can bring it that, even in modern medicine. So I think till that part is fine. But we have seen people going to the other extreme and eating n number of things which is, not any Ayurvedic doctor has prescribed, but on there, as you rightly said, the circulating in the WhatsApp, and people are eating, so many things that can harm the kidney. So I have seen people coming with the heart attack because they have been using these things. They have come with kidney failure. They have come with n number of problems. So this is not that it can be cured, because science has proved that it is a virus. And anything which is, keeps your oxidation level healthy, if your vitamins are right, vitamin D and vitamin C has shown to have real correlation. And those things indirectly can be put in, that if you are immunologically strong, meaning thereby that if you have got adequate, proportion of these vitamins in your body, you are more protected than those who did not have. But beyond that, these myths has to be busted, and we need to advise people that, keeping mask and hand hygiene and social distancing will protect you more than, eating these things which has no proof of concept, and there's no, data which supports these things.
Right. One last question, Dr. Kumar. And we've been hearing a lot of people saying that if they've had COVID, they have developed antibodies, and hence vaccine is not required.
That's again a big myth. So there is no denying that after COVID infection, there will be antibodies, but these antibodies do not last forever. So they will protect for a month or two or maximum 3 months, because it has been seen that they start disappearing from body, and it will not give a long lasting, for a year or 2 or 3 years immunization and immunity from the infection. So those who have had infection with COVID, they are also advised to take vaccine, though the vaccine timing should be at least 4 to 6 weeks after recovering from the COVID infection, so that you don't get reactions and you develop adequate immunity. So anyone who has had infection with COVID, they should also take the vaccine. Only thing is that during the active phase of infection, one should not take the vaccine. Otherwise, it will potentiate and increase the infection complications.
Absolutely. Thank you so much, Dr. Kumar. And I think some very definite, answers that have come from you to all of us. And the fact, whether it is cardiac arrest and COVID, or the very fact around vaccine hesitancy, and the reason why vaccination is extremely paramount and important, especially during this crucial juncture that India is going through when it comes to the spread of coronavirus. I'm sure our viewers are going to really pick up a lot from this. Thank you so much for being with us.
Thank you, Shifra. Thank you. Bye.